Hello, and good morning or afternoon, depending on where you're joining us from today. Welcome to our webinar about the Evidence for Action Matching Service Call for Proposals. Evidence for Action, or E4A, is a signature research program of the Robert Wood Johnson Foundation based at the Center for Health and Community at the University of California, San Francisco. Before we begin, I want to take just a minute to clarify for all participants that this webinar is focusing on the Matching Services Call for Proposal for Evidence for Action, which is seeking a matching grantee to manage our new Applicant Technical Assistance Initiative, the Matching Service. So this webinar is not for those who are interested in receiving those services or participating in that service at some point. So I just want to clarify and make sure we're all in the right place before we take off together. So I am Erin Hagan, the Deputy Director of Evidence for Action. Joining me today is our Director, Nancy Adler, and our RWJF Senior Program Officer, Claire Gibbons. During the call today, we'll briefly introduce you to Evidence for Action, provide an overview of why we're launching a matching service and what we're hoping to achieve, discuss the characteristics we're looking for in both the matching grantee and the network of researchers that service has access to. We'll share some information about how to apply under this call for proposals, and we set aside quite a bit of time to answer questions at the end of our presentation. If you have a question at any time throughout the webinar, please type it into the chat feature at the bottom left-hand side of the conference window, and we'll get to it upon the conclusion of our presentation. Also, if you have any technical issues during the conference, someone from ReadyTalk, our platform provider, is monitoring the chat and should be able to assist you. With that, let's get to the content. Nancy, can you start by sharing a little bit about Evidence for Action's mission and background?
Sure, I'm happy to do that. The mission of E4A is to support research that's likely to yield compelling and convincing findings regarding population health, well-being, and equity impacts of specific policy and program interventions. And during the first 3 years of our program, our primary means have been by supporting investigator-initiated research grants. And these are the sorts of applicants that we will expect to be using the services of the matching organization. We're now expanding our strategies for accomplishing our mission by instituting this new technical assistance service to support applicants in developing rigorous research studies. So let me just give you a little bit of background about where we are in E4A. As I mentioned, we launched as an investigator-initiated research funding program about 3 years ago, and we released our rolling CFP in June of 2015. Since then, we've received over 1,275 letters of intent. We've invited 84 full proposals, and we've awarded 32 research grants. What this means is that approximately 8% of our letters of intent are invited to submit a full proposal. This seems like a small percent, but we've tried to make the bar fairly low by having the letter of intent stage so people don't have to invest a lot in writing a long proposal if it's not going to be likely to be funded. We've invited then, of the 82 full proposals that we received, we've awarded approximately 32 actual research grants. And so that means that 40% of the full proposals have been funded. So Erin, could you provide some context about our process for reviewing and making decisions about applications?
Absolutely. So during this review, both at the LOI stage and the full proposal stage, we have 6 selection criteria on which we evaluate proposals that are submitted through the research call for proposals. So we're looking at the rigor of the research design, the actionability of the findings, the relevance of the research with respect to the Foundation's Culture of Health Action Framework, the contribution of the research to the evidence base, and inclusion of health outcomes. We're also looking at the feasibility of the project, which includes the ability of the applicant to carry out the proposed research. So these are the points that we're really, some of these criteria are the points at which we as a program are trying to intervene to improve the competitiveness of some of the proposals we receive. So there are three possible outcomes from a letter of intent review. We would either invite the applicant to submit a full proposal. We might turn down the letter of intent, and as you heard Nancy state, that actually is the most common outcome currently. Or we would refer the application to one of two technical assistance services. And this referral to technical assistance is relatively new for us. So we often receive applications that highlight innovative or important interventions, but for which the proposed research design does not meet our standard for rigor. In the past, we've invited many of these applicants to revise and resubmit their letter of intent, but we've found that they often need more assistance to develop a competitive proposal. One of the reasons is that while organizations that are implementing program and policy interventions at the community level often have a unique knowledge and understanding about the sorts of strategies that have the greatest potential for success, and they often have the infrastructure to implement these initiatives, they may have limited research capacity internally to design and carry out sufficiently rigorous evaluations of the intervention's impact. So these are the sort of applicants that we anticipate referring to the matching service to be paired with research partners. Nancy, let me turn back to you to talk a little bit more about what we hope to achieve with the matching service.
Great. So as Erin just said, we have tried to think about how we could increase the capacity of community-based organizations to achieve the kind of rigorous research that we've been looking for. And the purpose of the matching service is to facilitate a partnership between those community organizations or those who are implementing community-based initiatives with researchers who can aid them in developing and conducting a rigorous evaluation of what they're doing. So our goals are to strengthen the rigor of evaluations of real-world interventions, to allow them to determine more definitively what works and what doesn't work to improve population health outcomes, to facilitate new partnerships, and to engage new people in building a culture of health. Now, what I want to point out that while we've been saying that we'll refer applicants to technical assistance, it might be more appropriate to say they will be invited to participate in these services. We will tell them about this opportunity and give them the option of whether they would like to take part in it or not. Ultimately, then, eligible applicants will self-select into the matching service. And this is important since the applicant's interest in and commitment to participating is central to our achieving these goals. So let me turn to Claire now to talk a little bit about the broader RWJF interest in the matching service.
Thanks, Nancy, and hi, everyone, and thanks for your interest in this opportunity. Let me talk a little bit about why we're interested in this matching service. So since Evidence for Action launched in 2015, we've seen a number of proposals come in for review that have had a promising idea and often a promising data set, but they lack an adequate study design, as Erin and Nancy have mentioned. And despite very specific feedback from the National Program Office after review, these applicants are often not able to improve their design enough to meet our expectations, and we have to turn them down. We don't want to turn down any applicant who has a good idea. We want to learn how to create a culture of health, and that means funding as many good ideas as possible. We're going to pilot this service through Evidence for Action because of its unique status as a rolling program that accepts proposals every day of the year. So this allows us to accept revised proposals immediately after an applicant works with the matching service rather than waiting a year until the call for proposals is open again, which is sort of the typical timing for most RWJF programs. If this pilot endeavor is successful, we hope to expand the matching service to other research programs within RWJF. Let me talk a little bit about the Foundation's expectations for this work. And our hope is that that we'll be able to fund as many good ideas as possible. So we expect that applicants who are referred to the matching service will reapply to Evidence for Action after working with a matched researcher and will ultimately receive a grant through Evidence for Action or possibly another RWJF program. So that's our ultimate goal. We understand in some cases that won't be possible, but that's really what we're aiming for. We also hope to support new grantees through Evidence for Action and other research programs. So we are sort of hypothesizing that some of the folks who know RWJF, who have worked with us in the past, are able to put proposals together that we're able to fund. And we're thinking that maybe some grantees who have not worked with us before haven't been as successful. We're really hoping to bring in some new grantees, new organizations through this effort. And I also want to clarify that we view this as an experiment. RWJF has not funded a matching service like this in the past, and in fact, we aren't aware of a matching service like this being funded through any other source either. So we expect that we're going to learn a lot. And because this is a huge learning opportunity, we're hoping that the selected matching service grantee will participate in ongoing learning with the National Program Office and with RWJF. So we expect the successful applicant will have an attitude of continuous quality improvement and will regularly be making changes to improve the matching service in response to the data that it collects. And Erin, now I'll turn it back to you.
Thanks so much, Claire and Nancy. Hopefully that helps to clarify for people our motivation behind this service. So we're going to talk in a minute about the characteristics that we're looking for in the matching service provider. But before we get there, I want to provide some clarification about the structure we're looking for in the composition of the service provider. So our experience suggests that all of the matching service provider characteristics that we're going to describe to you may not be readily present in a single organization. And for this reason, we strongly encourage individuals from different organizations with complementary qualifications to partner together to act as the matching team. For application and award purposes, there must be one organization that serves as the lead and will officially be the grantee for this service. The lead organization may, and again is encouraged, to partner with other organizations who would logistically serve as subcontractors under the lead organization to form a team. For the purposes of this webinar, we frequently will refer to the matching team, but I just wanted to take a minute to be clear about what the logistics are for making up that team and applying for this award. So the awardee will ultimately be selected based on the characteristics of the matching team itself, the characteristics of the researchers in the team's network that could be matched with referred applicants, the proposed approach to facilitating partnerships, and the team's commitment to ongoing learning and continuous quality improvement throughout the course of the pilot. Let's go into a little more detail about how we'll evaluate each of these criteria. Nancy, let me turn to you to share more information about what the matching team will do and what characteristics we're looking for in both the team and their network of researchers.
Sure. The matching team is going to be responsible for a number of tasks associated with managing and carrying out, as well as evaluating the matching service. So one responsibility of the matching team will be to identify and continue to expand and cultivate a cadre of qualified researchers who have an interest in partnering with organizations who are implementing interventions at the community level. And we'll discuss the desired characteristics of those researchers in more detail in just a bit. When applicants are referred to the matching service, we'll share the applicant's letter of intent and other relevant application materials with the matching team. The matching team will then assess the methodological needs of the applicant and other considerations that might be relevant to identifying potential research partners. this can include things like geographic location or study populations or other things that would affect how good it would be to have a certain researcher matched with them. Once potential researchers are identified, the matching team then will facilitate the partnership between the applicant and the researcher, and they'll also be responsible for tracking the progress and outcome of these partnerships. As Claire mentioned, we expect that the matching team will work closely with our E4A team throughout the pilot to continuously refine and improve the matching service. So there are, if we can go to the next slide, the characteristics of the matching team are several. One is that they should have advanced research design expertise, since that's what's really needed to make sure that the community organization can come up with an adequately rigorous design. Now, matching team members won't be conducting the research themselves, but their ability to identify appropriate research partners will obviously depend on their ability to understand how a rigorous study could be designed and who might have the expertise to help that organization to do so. Now, actually, as important as a team member's understanding of research design is an appreciation of the nuances of conducting research in community settings. And so it will be important for us that the team have a track record of working with community groups. Now, together, the matching team members should also possess a strong understanding of what goes into the culture of health, including issues of population health, health equity, and the social determinants of health, although this need not be the sole focus of the applicant organization. So basically, crucial to the work of the matching grantee is a broad network of qualified researchers across multiple disciplines and sectors that can serve as potential matches. And we'll discuss the characteristics of researchers in this network shortly, but let's transition now to talk about the characteristics of researchers within the network and what they should possess. These are the people who could serve as potential partners to referred applicants. So the term network is not intended to suggest some sort of formal interrelationship among the researchers. The matching grantee's network of researchers may be based on formal or informal connections, and we expect that these will likely expand as they see the need for different types of researchers over time. The researchers within the network should represent this wide range of design and methodological backgrounds, a range of disciplines and sectors, and geographic distribution. All researchers should have experience conducting field-based research and evaluating social interventions. This will be important for among the network of researchers that there are those with content expertise in one or more areas of the culture of health action framework. They should have experience collaborating with organizations working in and with communities, as well as a commitment to conducting research with an eye towards equity implications, and experience disseminating research results outside of academic venues. These are all things that we aspire to for our the studies that we support through E4A. We also expect that as the matching grantee, you'll have a plan in place to screen and recruit and incorporate interested researchers into your network. We don't have a specific vision for the actual approach the matching grantee will take towards facilitating partnerships, and that's where we're looking to all of you for your ideas and creativity in planning this. So now that we've touched on all the things that the matching team will do, Erin, can you talk for a minute about a few things the matching team members won't be able to do while they're serving in this role?
Yes. So there are a few restrictions associated with being the matching grantee. Matching team members will be ineligible to apply for other Evidence for Action funding opportunities during the 24-month pilot phase. or to pair with referred applicants. We expect that the matching team members will facilitate partnerships, not participate in conducting the research. I want to be clear, though, that these restrictions do not apply to other individuals who are affiliated with the organizations that house matching team members, only the team members themselves. Although we anticipate that the majority of partnerships will come from outside of the organizations that house matching grantee staff members or matching team members, it is permissible to match referred applicants with individuals who are housed within or affiliated with the organizations that partner or house the matching service. So now let's switch to the logistics of applying. Under the matching service call for proposals, the matching team, or specifically the grantee, will be awarded $700,000 over a 24-month pilot phase. Of the $700,000, at least a minimum of $200,000 needs to be reallocated to referred applicants and or researchers as seed funding to help offset costs associated with early-stage partnership development. Those costs could include travel expenses, stipends, supplies, materials, etc. But all of those dollars, the $200,000 minimum, must be reallocated outside of the matching grantee organization. Full proposals, this is a one-stage proposal process. Full proposals are due on April 26th by 12 p.m. Pacific Time, 3 p.m. Eastern Time. It is recommended that you plan to submit your proposal in advance of that deadline. In case of any technical difficulties, we cannot accept late submissions. We'll be conducting interviews for finalists either May 18th or May 23rd, and we will notify the selected applicant on June 1st. Applications must be submitted through the Robert Wood Johnson Foundation's application and review system, which can be accessed online at this URL, my.rwjf.org. So let's turn to the contents of your application. The main portion of the application is an 8-page proposal narrative that will include 3 major components: the matching team capacity and experience, in which you will describe both details about the qualifications of your team as well as descriptions of the networks of researchers you have access to. You'll also lay out your approach to matching and a plan for how you will engage in ongoing learning and quality improvement. The proposal narrative template in the application and review system contains detailed instructions about the specific information we want included in your narrative, along with guidance about how much of your proposal should be dedicated to each section. Please review the template closely and respond appropriately. In addition to the proposal narrative, you'll also be asked to submit a variety of other information about your application, including a detailed budget worksheet and narrative. If you have questions about any of the sections of the application, please feel free to be in touch with us directly. All right, with that, let's open it up now for your questions. If you haven't already, I have seen that a number of questions have been coming in as we've been talking. If you haven't already typed your question in, please do so into the chat function. We'll answer as many questions as possible. I want to also note that there were some questions that were submitted during the registration process, and we'll include those at this time as well. Please keep in mind that we are not able to answer questions about specific applications at this time. So if you have questions that are very specific to your unique situation, I encourage you again to contact us directly after the webinar. All right, so let's jump right into it. One of the questions, I'm actually going to start with a question that was submitted during the registration process. Which was, what is considered a successful outcome of a match? And I think that Claire touched on that briefly when she talked about our ideal goal for evidence for applicants to reapply to Evidence for Action to be funded. But Nancy, maybe you can talk for just a second about some of the other possible outcomes we anticipate. Nancy, I think your line might be muted if you want to chime in.
Oh, you're right. I've completely answered the question offline. So let me repeat what I said, which is, well, as Erin indicated, we would hope that a number of these will result in successful applications to the E4A program. We would also consider as an acceptable outcome of a successful match that there may be mutual acknowledgement that the project is not yet ready for a rigorous evaluation, where the community organization would, with a researcher, come to that decision. But other possible good outcomes would be there'd be development of plans for baseline data collection that may make it ready in the future, or design of a pilot or demonstration project, or development of a research plan, and the research application gets funded elsewhere.
Great, thank you. Claire, do you want to add anything from the Foundation's perspective about potential outcomes?
No, I think Nancy covered it. Thanks.
Great. So let me turn now to a question from the audience here today. The question is about how we evaluate the rigor of the research design, and if we could elaborate a little bit on the aspects of what we're looking for in rigor. So important question. Let me start with one point, and then Nancy, I'll turn to you to add. And I think we're really, for the most part, looking for people to be able to draw causal inference. So we're looking for studies that are powered appropriately and that are designed to account for compounding differences. One of the things I think is unique about our criteria related to rigor is the way that we consider either positive or null findings. And so, Nancy, if you want to talk just a minute about what how we think about positive and null findings, that I think will be helpful to people.
Absolutely. But what we hope is that the study will allow the researchers and the organization to say, does this intervention have a causal impact on the kinds of outcomes we care about with population health and well-being and equity? Our ideal is that it be so well designed that a negative finding is informative, that it really suggests that if this intervention does work, you should have seen it in the data that were collected, so that you can conclude from a null finding that perhaps this doesn't work, as well as what we hope for, which is that there would be a positive finding that it does work. So it's implicit in how people design research, but we often make it explicit in evaluating designs to say, well, could something be learned? Is this strong enough that something could be learned from a negative finding, rather than just attributing it to, well, obviously there wasn't enough power, or there were confounding factors that made it impossible to see an effect.
Great, thank you. So the next question from our audience today asks, is there a current design consultation TA provider? And are there expectations for coordination between the matching team and the design consultation team? So thank you for that question. We provide design consultation in-house at Evidence for Action, and so by default, the coordination between the Evidence for Action National Program Office and the matching service provider will be close and aligned well. And let me say one more point about how we distinguish between who is referred to or invited to design consultation versus who is invited to the matching service. As Nancy mentioned, ultimately, once both services are up and running, we actually will let people choose which service they think is appropriate. And so it might not align exactly with our expectations. We think it's important for people to self-select in this case. But what we're expecting is that people who have internal research capacity, so they are already partnering with a researcher or are in fact a researcher, are likely to be referred to or encouraged to take advantage of the design consultation. The expectation is that those are folks who do have internal capacity to carry out research, while people who are looking for a researcher to partner with will be referred to the matching service. One additional point is that as we're starting to advertise to people in the field who might want to take advantage of the matching service, we are indicating that they can indicate in their application at the LOI stage that they are interested in the matching service. So there's a section of the letter of intent application where people could indicate that they're looking for matching and they want to be paired with a research partner. This is something that we encountered quite a bit when we first launched the program, where people came to us to ask for assistance in this area, and we didn't yet have the system or process or capacity ourselves to help people with this. And so we're going to go back into the field and advertise to people that this service is available, and we expect that people will apply and look to take advantage of this on the front end of their application process. All right, so moving on, it looks like in a couple of the questions that we got in advance, I think people had already logged in and looked at the application requirements, which is great. I encourage everyone to do that, to go ahead and log into the system, create an application for yourself, even if you're not sure if you're going to apply. So there's a couple of questions that we got in advance that were asking about some other components of the process that we did not touch on today. So one of those is that we do ask for letters of commitment from partnering organizations. And so one of the questions is, who are you expecting letters of commitment from? Do we need letters from researchers in our network? So what we want to say is, if you are partnering with another organization to form a team, as we described, we want letters of commitment from each organization that is housing a proposed matching team member. You may also include letters of commitment from professional organizations or others that have agreed to aid you in finding potential research partners, but you do not need to submit letters from each of the researchers in your network, and we're not looking for letters of support from people who are endorsing your qualifications. We really only want letters of commitment from people who you might be partnering with. So the next question is, can the lead organization be the university and a community-based organization be a subcontractor? Is it only vice versa? So in terms of who serves as the lead organization for your application to matching, to become the matching service provider, it really is up to the team of people who are submitting that application. And in general, what we say is that people should make the selection based on what makes the most administrative and logistical sense. So you really want to choose a lead organization that has the ability to administer the funds. In this case, that would mean both the ability to administer funds across organizations that are serving as the matching team, as well as to re-grant or redistribute funds to the referred applicants and the researchers that you're matching them with. Moving on, does the network need to be nationwide or can it be regional? So in general, this is a nationwide service. I think that's really important to highlight. We're looking for a matching team that can provide this service nationally. E4A is a national grant-making organization, and we receive applications from all over the United States and the territories. And so one of the unique aspects of this service, as Claire mentioned, or when Claire mentioned that we aren't aware of anyone else who's done this, we know that there are local matching services that operate locally, but we're not aware of any that operate nationally, and that's really important. And to be competitive, you will need to be able to demonstrate that you can provide this service at a national level. Okay, next question. Nancy and Claire, I know these are a lot of logistical questions, so I'm sort of taking the helm, but I want to invite you both to jump in if you'd like to add anything that I'm not covering or that you think is important to incorporate.
Hey, Erin, it's Claire. I did want to add just one thing to your explanation of that we're looking for national services, and that's really the primary motivation for us thinking about this as a team and bringing multiple networks of researchers together, because ideally we'll have researchers not just in the Northeast or the Midwest or the West, but the researchers kind of all over the country. And because we're not really aware of a network that looks like that is also diverse across disciplines and across backgrounds and areas of interest, we really are thinking that you all may want to be bringing networks of researchers together. And that's how we expect that we'll be able to get national coverage. But we've got to start at the beginning. So we'll see how that goes, but that's what our expectation is.
Yeah, and if I can elaborate on that for a moment, we don't expect that you can necessarily find the researcher who has exactly the right set of research skills and experiences in the same town as an applicant, but where possible, we think geographical proximity makes for an easier partnership. So again, it's not that, it doesn't have to be matched that way, but it is preferable if you can have a broad enough set of researchers that you can match it, you can at least have them in an area where they can interact in person for some period of time.
Great. Thank you both for that added context. There is another question about if it's possible to see successful past applicants to evidence for action, and similarly, examples of applicants who we might have referred to this service had it existed previously. So in terms of successful applicants, those are now grantees. On our website, evidencefораction.org, we highlight all of the grantees, all the projects that we have funded, and there's quite a bit of really great information there. There's both the high-level summary of the project as well as the detailed explanation of the methods being employed, the outcomes being measured, the size of the grant, the duration of the grant, et cetera. So I would encourage you all to take a look at our grantee page of our website. In fact, our entire website, I hope, it provides useful information both for this particular call as well as our rolling call, which is where many of the applicants will be referred from. In terms of the previous applications that were not successful or that would have been referred to the service had it existed, those applications are confidential. We cannot share them with you. However, once we select the matching team, when we refer an applicant to the service, we will share with you all of their application materials. So you will have all of those materials available and be able to review them along with having conversations, of course, with the applicant themselves. So at that point, we will be able to share that information with you. So there are a number of questions here that I'm going to sort of, there's a couple of different themes that I'm going to try to clump together that are coming in from a number of people, which clearly says we need to speak more about this. So the question are sort of about where the researchers should be coming from, if they should be coming from a university or should they all be from the same institution. So the network of researchers, I think, is what people are asking about here. So I know we described it just a little bit, but if we could talk more about the sort of institutions that we would be looking for researchers to come from, I would say it could be very broad. But Claire, maybe if you can take a minute, I know we've talked about this a lot with our colleagues in the foundation about the breadth of institutional representation that researchers could be coming from in this network.
Sure. So what we're most interested in is having a well-rounded, diverse set of researchers who meet the needs of our applicants. So people who are deeply aware and have a lot of experience with a variety of methods and methodologic approaches, as Nancy and Erin spoke about earlier today. I would also say that we're really hoping to be able to work with some organizations we haven't worked with before. And so it matters less what type of organization the researcher is housed in, and it mostly matters the researcher's capabilities and background and interests being a match and a fit for the evidence for action applicants. And, again, we're really hoping that we can bring in new researchers, and get exposed to new ideas and new folks, both through the evidence for action applicants, and also I think it'd be a plus if we could get that in our research networks as well.
Great, thank you. So there are a couple other questions that came in both in advance and here today. So one is, what's the expected amount of applications that would come from organizations to PAIR? So I think what the question is asking about the referral, how many applications do we anticipate referring to the matching service? This is a little bit uncharted territory, so we're sort of going based on our expectations and experience with applicants we likely would have referred in the past, but we know that as this service gets off the ground, we anticipate that we'll get a higher demand. Based on our experience so far, we're sort of expecting maybe 1 to 3 applicants to be referred each month. We fully recognize, as we've mentioned a number of times throughout the conversation today, the need for ongoing assessment and flexibility based on the experience of implementing this new approach. And we do ask in the application process that you give us a sense of what you think your capacity would be to manage the process that you put forward in terms of the number of applicants you think you could meaningfully engage with each month. But that's sort of our expectation for the moment. And then there's another question that is about the track record of the organization that would be applying in providing this service. So as we mentioned, we do think that this is a new service that we're asking for, especially the scope and level at which we're asking for it. So we wouldn't necessarily expect that anyone has done this at this scale before, and certainly if this is something that's totally new, but you could demonstrate that you meet all of the characteristics and qualifications that we've outlined today, we're certainly willing to consider applicants with varying levels of experience doing something similar. But Claire, you might have something to add about the track record of the applicant, and Nancy as well, if you want to add about the track record of the matching grantee in providing this service.
The only thing I'd add, Erin, is that although you may not have done this exact thing in the past, which, like Erin said, we're not expecting necessarily that anybody will have done exactly this, I think it's the capabilities and capacities to recognize, to kind of diagnose the problem with the applicant, to understand it, understand what the NPO is saying about what the areas of improvement, and then matching them appropriately with a researcher. So kind of demonstrating that you have that capacity. It may happen through working with students or working with coworkers or working across sectors or organizations, that those kinds of capacities could be demonstrated.
Yeah, and actually I can add that we're not looking for organizations that have had this exact experience, since there are relatively few, if any, that have done it quite in the way we're asking to have this done. But part of the application process is for you to describe how you would do this. So I think the more you can articulate how you would go about it, so we could envision it, again, given that you won't actually have the experience, that would be very helpful.
Yes, thank you both. So there are a handful of questions about the grant itself from Evidence for Action or from the Robert Wood Johnson Foundation to this matching service grantee. So I do want to clarify this is one $700,000 grant that will be awarded to one lead organization. Of that, $200,000 must be redistributed. There are a number of questions about how we expect that money to be redistributed that we'll touch on in just a second, but I do want to say that what that means is that a maximum of $500,000 can be used for operations internally within the lead organization and subcontracted to any partnering organizations over the course of the 24-month pilot period. You are not required to distribute that money equally over the 2 years, nor are you required to distribute the money equally among partners. That you'll describe to us in the budget your plan for how that money should be used. The $200,000 may be used for a variety of purposes and which are not rigidly defined at this point in time. What we know is that these sorts of activities take time and energy and often require resources to support. And so we're really willing to consider a variety of ways of supporting these partnerships, and we think that each partnership may be unique. So it may be that you would pay for travel expenses so that researchers and community groups who are not based in the same location can meet with each other in person. Perhaps you need to cover some time of a community organization, institution, staff, and or time of a research partner so that they can engage in conversations with each other. It may be that a variety of other costs that could be appropriate would come up. And again, this is one of those areas where we expect to work really closely with our National Program Office to determine what seems appropriate, at least early on in this process. And there is no specific set amount, so we expect that some partnerships may require $500 worth of support, and others may require $1,500 worth of support, and that this could vary across partnerships. Claire or Nancy, do you want to add anything to the expectations around the funds themselves?
No, I don't have anything to add.
No, I think you explained it well.
Okay, great. Moving on then. So there are a couple of questions about the focus of the lead grantee, whether they have a specific focus on a homeless population or relationships with homeless coalitions, or a specific focus on care providers or partnerships with hospital service providers. So any of these might be appropriate. As Nancy mentioned, we don't have an explicit requirement around the broad focus of the organization and individuals who may come together to form the matching team. It is important that people on the team have a strong understanding of population health, and I will say that defined in the way that the public health sector defines population health versus the way that the hospital and care provider sector often defines population health very specifically to the hospital population, the hospital's population of patients. But certainly homelessness, housing, food security, economic stability, et cetera, these are all what we might call social determinants of health that play heavily into the vision and framework of building a culture of health. There is, moving on to the next question, we talked some about the restrictions on the matching team. This question says, I'm curious if there are any restrictions on the research network, in particular in regards to publishing their results. Many researchers in this network are interested in publication, and are there any restrictions on the research network? So I think there are not a lot of restrictions on the research network. I did mention that we are, and Claire mentioned that we're really interested in engaging new partners, new researchers in this work, and so we would hope that that would be considered, but it certainly doesn't limit the ability to partner with researchers who maybe already have a bit of a history with RWJS. We do expect that these are rigorously designed studies that might come back for funding that would be publishable and should be published in academic journals. As Nancy mentioned, though, we have a really strong focus on the actionability of the studies that we fund, and so academic journal publication is never a sufficient final deliverable of evidence for action grants, but it certainly is encouraged and supported, and most of our grantees do publish academic journal articles in addition to other forms of dissemination. Nancy, do you want to add anything about the research network and the researchers in that network and some of the outcomes?
Yeah, I would hope that in a successful outcome where a project gets funded, that there would be a publication, and it would be appropriate that the researcher, if they played a vital role in it, would have that publication. So I see no problems with the issue of publication. What we're trying to get away from is researchers sort of commandeering an evaluation and not including the organization that was actually doing the work. And this really would need to be the team that's made up of the organization and the researcher. But if it's going well, I would think that everybody would want this to be published, and that the researchers should be able to get a publication from their work. But the idea is really to create a team that can do the work necessary to evaluate the policy or intervention.
Great, thank you. So I'm going to try, there's still quite a few questions. I'm going to try to get through as many of them as possible. We probably have enough time for a handful more. I know we may not get to all of them, and again, people can contact us directly as appropriate. So I think there are a couple of questions that have come in since we sort of tried to clarify what we're looking for in terms of this national scope. So let's try this again just to make sure that people understand. So we at Evidence for Action receive applications from all over the United States and the territories. And anyone who sends an application to Evidence for Action could be eligible to be referred to the matching service. And so it's going to be really important that the matching service team be able to cultivate, facilitate partnerships for any applicant that we refer. And that is our expectation, that all applications referred to the matching service result in a facilitated partnership. Now, as you've heard, there are a variety of outcomes that could happen after that partnership is facilitated, with our primary goal being to have a successful reapplication to the Evidence for Action program. But it would not be acceptable for us to refer an applicant to the matching service that then the matching service would come back to us and say, we can't find a partner for this, we can't find a research partner for this applicant unless the applicant decided to withdraw from the process after the initial conversation. So hopefully that helps to clarify. If you currently have a strong partnership with a very local or even regionally strong partnerships, which is something we know exists, you either need to partner with other organizations who can expand your network of researchers to a national scope, or this may not be the right the right opportunity for you. But let me, having said that, because I feel like that was sort of heavy-handed, let me turn to Claire first, and then Nancy to see if you'd like to clarify further.
Yeah, I think the other thing I'd say is, given that this is a pilot, it may not be possible to start with everything that we hope to have. And so if you're considering applying and you have a very strong network, but it has some limitations, then we'd like to see, if you want to apply, we'd like to see in the proposal how you expect to fill out those areas of weakness. And some early conversations or some letters of support from other organizations that you're working on, that is going to go a long ways. So we understand that what we're looking for is something that doesn't exist. It has to be built, and that part of the pilot period will be building that and those relationships. But as Erin said, we can't start too small and too focused. And I'd also say that's also relevant to the question about, hospitals and homelessness. It's entirely appropriate for the home or lead organization to have a specific topical area of expertise, but we can't sort of put all of our proposals into sort of fitting a round peg into a square, or vice versa, a square peg into a round hole. Not everything is going to be about homelessness or about hospitals or about primary care. In fact, many of our proposals are not at all about those things. So I'd recommend, taking a serious look at the Evidence for Action website and getting a strong sense of what are the proposals that we funded so far, because they really run the gamut of culture of health. And the strongest applications will have researchers that are diverse and can focus on many different areas of the culture of health, and home organizations that can kind of reflect that to some extent as well.
Great. Thank you. Nancy, do you want to add anything?
Yeah, and this may be a little repetitive of what I said before, but we don't expect that everybody already has a wonderful network that goes across all of the United States and territories. So what we're really looking to you in the application is to say, how would you match somebody in an area where you don't have somebody in your research network? How would you go about finding somebody and then recruiting them into the network? Because we assume that you'll start the network, but as you add people, partly through your experience with the E4A grantees or potential grantees, that you will expand what you have in your network.
Great. I think those are both hopefully helpful clarifications. So I'm going to take one more question. I know we have not gotten to all of them, so if we haven't answered your question sufficiently, please feel free to follow up with us directly. We also have frequently asked questions section on our website. So the last question I'm going to take right now is, how do we see the learning process working in partnership with Evidence for Action? What kinds of research processes do we anticipate growing out of the matching service partnership and to improve impact overall? So great question, really important to us. In general, we expect to have close communication between the National Program Office and the matching team. And in fact, we plan to have an in-person onboarding process where we will really help to acculturate the matching team to the Evidence for Action value system and the broader Robert Wood Johnson Foundation culture of health vision. And then we expect to have ongoing, frequent communication and sort of honest and open dialogue about what's working and what's not working. But let me give you, Claire, and then you, Nancy, the last word on this, sort of the learning process.
Nancy, why don't you go first?
Well, I think the learning process will itself be a learning process for us. We don't really know exactly how this is going to work out, so we're hoping to have a matching organization who goes into it with the same level of enthusiasm and openness to really exploring what's working and what's not working.
That's great. I think that's exactly right, and I think it's sort of a mindset that we're looking for, which is it may go swimmingly right out of the gate, but we still want to make improvements and make it better. And we also want someone who can continue to think with us about, well, this is a pilot. If we wanted to extend it and make it a pilot and a half, in future years, how could we do that? How could we expand to other programs within RWJF, and what could we do? And kind of be thought partners with us about potential other roles for a matching service, assuming some level of success in this initial pilot. So we're looking for a thought partner as well as sort of an action partner. Thanks.
Perfect. Thank you. So as I acknowledged, I know we did not get to all of your questions. I apologize for that. You are, as I also have mentioned, you're welcome to be in touch with us. There's a variety of ways to reach out. I do encourage you to review our website closely, evidencefораction.org. We have added frequently asked questions about this opportunity specifically. You can also email us directly, our phone, our Twitter handle. We have a presence on other social media sites. And then, of course, the application is on the Robert Wood Johnson Foundation Application and Review portal. I want to thank you all for joining us today, for your interest in this work, and that concludes our webinar.